Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about interview tips for new medical coders. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, you have passed your certification exam, you have started applying, and you're starting to get those callbacks to get to those interviews. So today we're going to talk about what you should and what you should not do when you are in the interview process. If you have had a chance, I hope you caught yesterday's episode about what to do after the interview. I did that episode first because I was getting a lot of requests for that kind of information. And this is just sort of a follow-up. So if you are interested in looking at that episode, I will leave that link in the description box below. So here we go. Okay. The interview process is quite possibly one of the most nerve-wracking, right? Because you are potentially meeting your brand new employer and your other coworkers. Sometimes you are interviewed by one individual and sometimes you are interviewed by a panel. It really all depends. A lot of times for medical coders, we are set up in a panel type interview. I have always been panel interviewed. For the most part, I've had one position where I was just one-on-one with my supervisor, and it was a good interview, obviously, because I got the job. But for all the rest of them, it's always been panel interviews. And you typically have somebody from data quality, somebody, obviously your supervisor, potentially that's going to be, and then sometimes maybe you have a doctor from the staff. I have not had a doctor from the staff, but I have had other supervisors and other data quality people that have been in the room when I'm doing my interview. So that is part of the interview process. It is totally normal. When you are meeting in person, obviously you want to be well dressed. You never, ever, ever, ever. There is no excuse for ever wearing blue jeans to a interview. Do not wear a jean jacket either. I know some people like to wear jean jackets and they think it's cute for an outfit for a regular day, but never for the office. That is just my advice. And don't ever wear t-shirts either. Guys, you need to be in a button-down shirt. Ladies, you need to be in a nice blouse and slacks or in a nice dress. So that is my advice there on that. But you do need to be well-dressed when you're going into these interviews. It is a business. It is not that you're going somewhere and you're going to be comfortable. It's not about your comfort, because you can still be well-dressed and still be comfortable. If you are not comfortable when you are well-dressed, it is probably because you are not getting the right clothing. So there is always a difference there. And there's plenty of YouTubers on YouTube that talk about proper outfits to wear. So that out of the way. You really do need to know where you are applying. A lot of times new medical coders will be asked that trick question, what do you know about our facility? And they'll just sort of stare with the deer in the headlights look. Guys, don't do that. Know where you are applying. Have an idea of what they do there. Do they see inpatients? Do they see outpatients? How big is that facility? And a lot of that information can be found literally on the company website. So that way you can kind of have some background to be able to talk about. Because they will ask you, what do you know? Do you have any questions for us? And of course, you're going to want to be able to formulate some of these questions so that it is specific to that facility or that doctor's office. And you don't want to ask things that are sort of off the wall, right? But you also want to make sure that you are thinking about every specific place that you are applying. So be very specific. You know, employers like that. They like to think that you are only applying there, when in actuality you should be, and hopefully you are applying at a lot of different places, because it is very important to keep as many resumes out there as you possibly can, because when you do this, it increases your chances for getting called back. Even if the position is requiring 3 to 5 years of experience, you still want to apply anyway. Because if you are applying for a medical coding position, you have been trained, you've passed the certification exam, you are qualified. The only thing that is missing is, of course, that time. But if you are not applying, they don't know that you're out there. And most medical coders who have experience are already going to be employed. So, you know, the employer may get desperate that they're going to call you. So That's just my advice on that one. But when they're asking you in this interview process, and of course you should always be very engaged. Do not mumble when you are speaking. Be very clear with your speech. And don't reiterate the fact that you have no experience, that you're a brand new coder, and who is going to train you. These are the types of candidates that don't get calls back, okay? Because medical coding is a very independent learning type of field. We are very autonomous when it comes to how we learn. Obviously, you learn this if you went through a self-paced medical coding program. Even if you've gone to college. College is the same way. You're going to learn on your own. So that is something that you need to remember when you're out there. You need to concentrate on highlighting your skills and the things that you learned in medical coding in the school. What did you learn? What have you been doing to continue your studies? That is very important. Did you take a formal medical terminology class or anatomy class? That kind of thing. If you didn't, it's okay. You certainly don't have to have that, but it does help because, of course, they want a medical coder who has lots of knowledge when it comes to that because that makes reading the medical documentation a lot easier, believe me. And when they ask you, do you have any questions? You can ask them things like, am I working by myself, or am I working in a group office if you're working at the facility, or are you working at home? If you're working in a group facility, or if you're working at home, are you working in a single clinic, or are you working in a queue situation? If they're having you work in a queue, that means that all of the coders will be working from one list, and basically, generally, you're going down this list and you're picking one encounter, and sometimes they have what the encounter was about, and sometimes they don't. It really all depends on the EMR. But you just click on it and then you start working. The problem that happens when you're working in a queue situation, in which for me, I will always ask that question if I'm applying. I will never work in a queue situation as a medical coder ever again, helping it. Okay, if I can help it, I will never work in a queue situation. The reason that I don't recommend working in a queue situation is because you will get medical coders who will skip charts. Oh no, Blue, that doesn't happen at our facility. Au contraire, yes it does. Because no matter how well people think that they are able to catch people who skip, trust me, there's always going to be somebody out there that gets smarter than the system, or able to outsmart this or outsmart that, and they're able to find ways to skip. And then all of a sudden you find yourself left with all of the hard stuff. Now, it is good to do hard stuff because it does make you a sharper coder. You should never run from hard stuff. However, I don't think that it's fair if all the coders around you are skimming through all of the easy stuff so that they can keep up on their production, and then you start to suffer. That's not right. And even when they say, well, we assign the charts, I still don't really feel comfortable with that either, because you don't always know what the situation is. And sometimes people can have their favorites. And so that's also another thing too. Do we know that the workload is being fairly distributed, right? So that's why I say I would rather work in a place where I am assigned to a specific clinic, or even if I'm being rotated, that's okay. But I need to know that it's just me working in that clinic, or that I'm part of that team that works in that clinic. And I am not working from a large queue with multiple coders, because that just doesn't work for me. It works for some people. But if you're out there and you're looking, that's a question you can ask. Are you working from a queue, or are you working as a single person in a clinic? You know, and the benefits of working in a clinic as well by yourself, you get to develop those relationships with providers, and that is very, very important. It's important to understanding what they're documenting. It is important to really becoming a better medical coder when you have those good relationships with your providers, because then you are able to really understand the specialty itself. And when you're able to do that, the coding gets a lot sharper, the details in the codes that are being selected is a lot better. And I just think that it's a good way to be. That's just my opinion anyway. This is somebody that works in orthopedics and podiatry, so that's what I have to say about that. The other thing that you want to do is you want to make it not about you when you're asking questions, okay? Other than what's the queue situation like. You can ask about, you know, what for like continuing education units, do they offer those there? Some employers, that's a benefit of employment. For other employers, you're on your own. It really does matter. I get free ones from my employer, so that's great. I get one every single month. And so that's a good thing, right? Because as you go along in this industry, you will get additional credentials if you choose to. All you need is one. Some people go through their entire career with just one credential, and they do just fine with that one credential. But if you're getting additional credentials, it does help if your employer is offsetting some of that cost of getting some of those CEUs by having free CEUs with employment. So that's a very, very big thing. One of the things that you don't want to ask is who will train me? Don't ask that question because the thing is, they're going to want to see if you are willing to, you know, do your own research. And they may ask you, how do you do your research? That would be one of the questions that I would ask is, how do you do your research? If you say you Google and that you just find like a thread or something, that's not good enough. For me, I'm going to look for the person that says that they're going to look through Coding Clinic, they're going to look through CPT Assistant, they're going to look through those types of reputable resources. They're going to use the Merck manual, those types of things. They're going to go to CMS because those are the reputable resources. You can't always trust what you see on the internet, right? Even if it's like medical billing and coding in the name. You can't always trust it because this is somebody that's writing an article, and it may or it may not be right. Or it may be just their interpretation, or it may be at their facility. That's the way things are done because that's the way their insurance is set up, and insurance is different based on where you are in the US as well. So different rules for different things. So that's why you always want to go to somebody that's neutral and reputable. Again, CPT Assistant, Coding Clinic, or going to CMS. You know, any of those are very helpful. You know, that would be what I would definitely recommend. When you have something like a panel and you are speaking to them, make sure that you're making eye contact with all the people. And if you get nervous, it's okay to say, hey, I'm a little nervous. But you need to go in there with a positive attitude. Again, not highlighting every 5 minutes that you're brand new, that you have no experience, and that you don't know what you're doing. You need to make an effort to show that you will learn and that you're very excited to do this, okay? If they are interviewing you and say it's for a remote position and they ask you, why do you want to work remote? And if you say, well, I want to work remote because I have my kids at home and I want to spend time with my kids, you would be on a no list for me. The reason that you would be on a no list for me is that is none of my business. That is none of my business, and you just ratted yourself out. Guys, what goes on in your home is none of your employer's business. What does matter when you are working in your home is, are you going to be engaged in the work? They don't need to know that you've got all this stuff going on, that you're taking care of a sick family member, or you have a child at home. They don't need to know all that. They need to know that your area and your location is secure, that there's not going to be people walking around looking at your screen, no matter how little the child is. If you have young children at home, it doesn't matter. You need to make sure that you are being clear that your area is going to be set up securely, that there's not going to be anybody walking around. It's going to be a clean background, especially if you're having a virtual interview. You want to make sure that you have a clear background. Make sure there's no barking dogs, no fur babies jumping around that will distract your interviewers. There's no kids screaming in the back. You need to make it quiet because it is a business setting that you're in, even though you are in your home, okay? So you want to sell the idea of being at home but you want to make it about the employer, because employers are all about themselves, okay? That's what they're about. They're not about, they are about their employees, yes, but they are more about what can this employee do for me? And that's what you need to kind of get into that mind frame about, okay? That it is about them. And the more you do that, the more successful that you will be, because yes, while you will have needs, right? There will be a time when you need to go to your employer to request something, you know, in specifics, you know, family member gets sick and you need to take some time off. There is always those situations that come up, but for the time being, you want to get in and you want to make yourself look like the best possible candidate. So talking about, you know, your family situation, oversharing about your home life, that's a no-go, guys. You want to give them just enough to be interested in you and to say, okay, this is a person that we can potentially trust to do this. So we're going to go ahead and give them a shot. You know, that's the thing. You want to make sure that you are showing yourself in the best possible light. You don't want to blow the interview, you know, and after you work so hard to get to the interview. Okay. So make it about them. Make eye contact, be engaged, you know, make sure that you are leaning in, not that you're leaning back, and don't mumble. Remember to speak clearly. If they ask you, there's a lot of questions like they try to trip you up on. Of course, how did you handle a situation where you disagree with a coworker? You really want to think about, what did you learn in that situation? They're not looking for perfection. They're not looking for you to say, oh, I've never had a disagreement with a coworker. They would know that that's a lie. Anybody who's been working in the working world has always had a disagreement at one point or another with somebody. And for some people, you know, they just let it, you know, fall under the rug. And then for others, you know, they had learned something out of it. So there's a thing there that you have to show. What did you learn, right? What did you learn from your experience with this? What responsibility did you take in the whole situation? That's what you need to think about. But really, you need to kind of redirect the question, which is, what did I learn from this situation? You know, they want to know how your coping skills are. That's what they're looking at as well. Because again, you're looking at personality of the person, not just their knowledge base, right? Because this person has to be able to get along with the other managers. They have to be able to get along with the other coworkers and the auditors. So because of this, you have to make sure that this candidate is going to meet all the markers, or at least majority of those markers. But, you know, don't ever get discouraged just because you have no experience. That's why you're trying to interview to get in. And accept and acknowledge that there's going to be a lot of these people that say, well, you don't have experience and blah, 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 you know. That's okay. That position was not meant for you. All right. That's the way you need to look at it. As I talked about in last night's video, it's important to know that not every position is made for you. There is a position out there for you, but you just have to seek and find. And you have to be mentally ready for the challenge. It is a challenge, guys, and you do need to be ready for it. A lot of times people will get discouraged and they will say, well, they're not hiring me, I'm not getting hired fast enough. And then when you look at the package that they're trying to sell to these employers, which is they've got demands, they want to work part-time, they want to work for 10-hour days, they want to, you know, do this alternative work schedule, they want to give a really bad resume that's 3 and 4 pages, sometimes 5 pages long, and not detailing what skills are they bringing. That's a package that they're trying to give to these employers. And so if you're doing that, of course, you're going to run into a lot of resistance from these employers. It's about getting into the mindset of what it's like to be a medical coder. What do medical coders need? What are their skills? And you can find that specifically what this employer is asking for by looking at the job description, making sure that all of these words are in your resume and they're in your cover letter. And your cover letter does not need to be a regurgitation of your resume. It needs to be selling your soft skills, the things that you didn't put on your resume, okay? You can kind of marry some of that stuff from your resume to your cover letter, but it doesn't need to be a regurgitation of everything that you have in your resume. I see that a lot. I do resume rewrites. My rates is in the description box below. And I see that so many times where it's just very general. It's a very general cover letter. It's a very general resume. And there's just overuse of all these words. It's about getting to the point, guys. And it's the same thing in this interview process. You got to get to the point. You don't have to give all this flowery language, but you do have to get to the point, and you do have to be very clear. And if you don't know something, you can say, well, I can't recall, but I do know how to find it. I do know I have to look in the ICD-10 CM book or the CPT book, or I know I need to look at Coding Clinic or CMS. That's what they want to hear, okay? That's what they're looking for, is somebody that, you know, maybe if you don't know everything, but you do know how to find the answer. That's the key right there. Do you know how to find the answer? And if so, how do you find it? You know, don't just say, yes, I know how to find the answer. And if they follow it up with, okay, where do you find it? And you look like a deer in the headlights, they know you just essentially didn't say the truth that you knew, right? So that's where, you know, I'm going to go ahead and leave this episode with. So it's interviewing. Yes, it is what it is. It's nerve-wracking, but it is possible to find a really good job. It is possible to start your career, but you do have to get out there and get with the program, as far as, like, they're going to reject you a lot, and you have to be able to take it and take what you learned and move it on to the next, okay? And don't wait and just only wait on this interview. If somebody else wants to interview you, go ahead and go to that interview as well, okay? Don't just wait on that employer, because sometimes it takes a couple of weeks to process them making their decisions, okay? And a lot of times when they're interviewing people, they will be interviewing a batch of people all at one time, and then it'll take them a couple of weeks to process that. Sometimes it takes 3 weeks to process it. And if it does, you know, you're not going to be hearing from them in all that time. So like I talked about on last night's video, it is acceptable to send a thank you note within 24 hours to your interviewer. That's okay. But don't start following it up every week and calling. Don't do that. Don't do that, guys. Okay, that's just my advice anyway. But best of luck to you out there when you are in this interview process. You will make it. You just got to be persistent. So I'm going to wrap this one up. Thank you guys so much for joining me. I hope you hit that like button. Subscribe if you haven't already, and I will see y'all next time. Bye.